Do you think your baby may be too big? Today, I'm going to tell you how they measure how big baby is and go through some of the things that you're going to want to watch for if you think that this could be a problem for you. And I've got to say, as a nurse in labor and delivery for 20 years, I saw a lot of patients who were really bothered by the fact that they weren't getting multiple ultrasounds to see how big baby is. And I'm here to tell you that sometimes the old-fashioned methods can be just as good. And if you're interested in insider tips like these, I actually have a whole insider tips series that I'm going to link down below for you. Okay, this first one that a lot of people think is far too old-fashioned is a tape measure. Yes, they measure your belly from the top of your pelvis to the top of your uterus, and that gives them an indicator of how big baby may be. Now, of course, this really depends on how much fat you have there, baby's position, but as they're recording this as you go through your pregnancy, they can start to get an idea if baby is trending big or small. And actually, the number of centimeters that they get should correlate about plus or minus 2, I think, to how many weeks pregnant you are. So if you are 38 weeks of pregnancy, this should be about 38 centimeters top of the pelvis to the top of your uterus. And yes, they even use this back in the day. If you watch Call the Midwife, they're always measuring bellies. It's just proven to be a method that works, even though it feels old-fashioned and you think you need an ultrasound. You know, as you're learning these different things about baby size, it may come to a point where you have to make some choices. And I definitely recommend a birth class that helps you to make choices in labor. Of course, you're going to need breathing, which is what a lot of birth classes talk about, but you also need assistance in making choices that are best for you. I'm going to link the birth class that I recommend that does just that down below. Now, with the tape measure, they should also be palpating your belly. And this is something that we call in labor and delivery Leopold's maneuvers. What they're doing is just feeling on your belly to see where baby's position is, how big baby is. It's really helpful. And the more you feel pregnant bellies and see ultrasounds, the more you realize where baby is in the womb. That's part of your OB's residency or your midwife's residency. Now, when you're doing this, you start to get an idea of the size of the baby. And as a nurse who worked in labor and delivery for a long time, I like to feel patients' bellies and then just sort of make a guess in my mind as to how big the baby was going to be. And the more often I did this and sort of corrected myself, honestly, the better I got at it. And the same is true for your OB. The more you feel lots of different types of bellies, the more you kind of get an idea how big baby is. Now, is there a surprise every once in a while? Absolutely. Sometimes babies are bigger and sometimes they are smaller, but it can be a good indicator with lots of experience. And I am here to remind you that an ultrasound is also not perfect. At the end of pregnancy, it's plus or minus 1 to 2 pounds. That's right, 2 pounds, depending on the type of ultrasound machine that they are using. So just because you want an ultrasound doesn't actually mean that it's any better than just feeling your belly. However, if the tape measure or the Leopold is off, we think baby is too small or maybe too big, we will order an ultrasound. Of course, it can tell us other things beyond just the size of the baby. But when we order the ultrasound, it usually gives us an estimated weight and a percentile, which that baby falls in amongst all the other babies that are due about the same time as your baby. I'm so glad that you're here with us today. When you like content like this, it shows YouTube that it is high quality pregnancy content. And as a bonus, it will also show you more high quality pregnancy content in your feed so that you can get prepared. Now, fun fact, in the early parts of pregnancy, babies all grow at the same rate. And that is why picking a due date based on your earliest ultrasound is usually what they go by, because babies, of 10 weeks are all the same size because it's ultimately just a bunch of cells. However, as baby progresses through pregnancy, they change in size. And if you were to look in any kindergarten or preschool classroom, you notice that there are kids of all sizes, and this is true for babies as well. So your provider is taking the information they learned from the tape measure, their hands, and they might be ordering an ultrasound, but I'm also here to tell you that the standard of care in pregnancy, at least in the United States, is an ultrasound early on in pregnancy, sometimes a nuchal translucency ultrasound if that's something you're interested in, and then your 20-week where most people learn the gender. It's also called the anatomy ultrasound, and those are the two that are standard of care to be ordered. Now, if you haven't had one of those, talk with your provider because they should definitely be ordering those for you during your pregnancy. But if everything else looks good, all the things look healthy, you shouldn't really need an ultrasound later on. However, if you're interested in one, talk with your provider. They might be a way that they can order one if you really just want to peek at baby. And some providers do an ultrasound in the office every time, but I'm here to tell you that the OBs are not amazing at measuring babies with an ultrasound. That really is the job of an ultrasound tech, or some perinatologists are good at it. So that's something to know if you're just getting a quick peek in the office. Now, if your provider has said baby looks big and they might be recommending a C-section or an induction early, I actually have a whole video on that. I'm going to link it up above. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.